Hi, I'm Anna and I'm from the west of England and I'm currently studying Global Maternal Health Master's degree at City University. I became interested in this because I'm a practicing midwife and I wanted to really explore and get into the social policy of midwifery, the public health of midwifery, but really keeping that political global perspective. And this course came on and it's absolutely perfect. So I'm actually the first cohort of this course. It's really fascinating. We've got amazing guest speakers from all over the world, which has been really inspirational. So I've really liked the theoretical grounding and I've liked the practical grounding. It's a very practical course as well. And I've really liked the range of guest speakers. Before starting this course, I've been working as a midwife, as a practicing midwife for quite a few years. It's been really great returning to study and really going back to those theoretical basis and studying kind of why we do things we do. It has been hard work, I'm not going to lie. It has been very hard work to really put aside time for the reading, get your head into that kind of theoretical framework. But I've really loved the way it's put the work that I'm currently doing. I'm doing it part-time and working part-time, and I've really loved the way it's putting that work into context. My favourite moment at City so far has been some of the lectures right at the beginning of the course where they were bringing in midwives from India, from Thailand, from Afghanistan, all over the world, and from the UN maternal health department as well, and bringing in that expertise. And it's just felt like an enormous privilege to sit in the class and listen to some of these women talk about their work. I also have 2 children, so I'm a mum, and I'm involved in some feminist activity as well, which again all feels like it's kind of come together with the theoretical aspects of the Masters. So I think professionally it has actually given me a real grounding. I'm applying for a lectureship job at another university, but I think more than that, this particular Masters is really grounded in forming the sort of professionals of the next generation. So we've learned a lot about implementation science of healthcare innovations, or healthcare ideas, putting them into practice. We've learned how to do policy briefs, so that it's been really practical. So I do feel like I could go in lots of different directions to this. It might be further into academia, but I can see either now or in the future one could also use it to really make a change within midwifery practice in a either UK or global context. One thing about the course is it's run by Lucia, who is a real innovator herself in the field of developing midwifery-led units and a network of midwifery-led units. And some of the other lecturers as well, Christine McCourt, a lot of the others, are really sort of at the forefront of women-centred care. And I think the way that the City University Midwifery Department has such a clear vision of the biopsychosocial model and of what that really means in terms of implementing that in care has been really inspirational, and I've felt really good being part of that team. So I think the developments I'm looking forward to is just further enhancing that, really, is seeing the midwifery unit network grow, promoting home birth, and really just promoting respectful women-centred care, and challenging any sort of pushback to that as we go. Don't underestimate the time it takes. I really wish I could devote more time to this. The reading's fascinating. There's so much. You can't make any shortcuts, really. And to do it credit. So not only because it does require a lot of work, but also because it's an incredible opportunity. And sometimes I feel like I'm kind of having to cut corners everywhere with the work, with the Masters, with the parenting. So I would say really sort of plan your life so that you make sure that you can really carve out a chunk of time to make the most of the experience, and just enjoy it. It feels absolutely great to be part of the academic community, particularly part of the City midwifery community, which I think is really innovative and women-centred, and I feel really proud to be part of it. Thank you.